Are Medicare Advantage plans really the cheaper option, or is it just more confusing? Medicare Advantage plan, Medicare supplements, which is the right plan for you? If you're turning 65, you probably heard a lot of opinions about both. We're going to cut through that noise. In today's video, we're going to break down the 5 key differences between Medicare Advantage and Medicare supplement plans. We're going to break down the differences in cost, doctors' access, like your provider networks, plan flexibility, who is better suited for each type of plan, and finally, the times in which you can actually make changes to your program should you wish to do so. Understanding these 5 key differences will help ensure that you find the right insurance that represents you. Hello, my name is Edwin John Rodriguez, your health insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of working with thousands of individuals regarding their health insurance and shopping plans based on their specific needs and goals. The best part is using me doesn't change your plan or your options. My help to you is completely free because I'm actually paid by the insurance company which you choose to enroll in. I'm contracted with most major carriers nationally, so conversations are transparent and free from bias. I often tell my clients I'm the best free help you'll never pay for. Now let's get into it. So the first key difference between Medicare Advantage plans and Medicare supplement plans is obviously cost. With Medicare Advantage plans, generally they're going to be offered to you at as low as a 0 premium plan. So no additional cost to you in addition to your standard Medicare premium. If you recall your coverage from prior years in group insurance or marketplace plans, you've generally had some type of out-of-pocket to pay as you seek care. Now, because these plans do have out-of-pocket as you go, there's a feature called a maximum out-of-pocket most insurance plans have, which is essentially a safety net capping the amount that you, the consumer, will actually spend in the calendar year. God forbid you have a catastrophic year, you will be capped out as far as how much you actually pay in out-of-pocket co-payments related to hospital and medical services. Now, with Medicare supplement plans, those plans can range in premium anywhere between about $100 to $200 per month, depending on your zip code. I like to call the Medicare supplement plans an all-you-can-eat buffet kind of plan. And the reason why is because with those programs, you pay a flat monthly premium, and that generally is going to guarantee no out-of-pocket and no network. With a Plan G program, you have no network. You can go to any doctor that accepts Medicare, and you won't have any out of pocket when you seek care. Essentially, Medicare is going to cover 80% of your health care, and your 20% and your deductibles is going to be taken care of by your Medicare supplement policy. Now, we have another video we'll link in the description below that talks a little bit more specifically related to both of these types of programs that you're definitely going to want to review to get a better understanding of each of these. Going the supplement route, you do have to add drug coverage separately. So there's an additional premium for the drug program should you wish to go the supplement route. Second is going to be doctors and hospital networks. With Advantage plans, typically they're going to come as either an HMO or a PPO program. With HMO plans, you're going to require referrals to see specialists, and you're going to have to use doctors within the plan network. Generally, with an HMO plan, you're going to be limited to your service area as well. We're here in Central Florida, so a client who has an Advantage plan is normally going to be limited to the service area here in Central Florida, unless it's related to an urgent or emergency situation. Alternatively, you also have the option of a PPO program with Medicare Advantage plans. With PPO plans, you have a network as well, but with those types of plans, you have the option to go out of network if you need to, and you have the flexibility to use the program nationally. Also, with PPO plans, you do not require referrals. So that might be a better suited plan for someone seeking more flexibility for travel. With supplement plans, you don't have a network. You can actually see any doctor that accepts Medicare anywhere in the United States. With these types of programs, you also do not require referrals, so you can go directly to specialists as you please. Supplement plans are going to be more ideal for snowbirds, folks who spend more than a few months of the year in another state, or they really have providers that maybe don't accept these Advantage plans. Would be more ideal to go with a supplemental policy. So you want to check with your doctors to see which programs that they accept related to Medicare. Third is going to be plan flexibility. Advantage plans are what we call bundled plans. Generally, these programs are going to include additional benefits like dental, vision, hearing, gym membership, prescription drug plans built into it. Versus with supplemental plans, you don't have any of those extras, and you're going to have to buy each of those items individually. Additionally, with supplement plans, you don't have prescription drug coverage built into it. So again, you're going to actually have to enroll into a standalone drug plan in addition to the supplemental program. So number 4, who are these plans best for? Depending on your situation will really determine which plan makes the most sense for you. For example, if you have minimal needs, you're relatively pretty healthy, or sometimes if you're on a tight budget, Medicare Advantage plans might be a better fit for you, as again, they're generally going to be offered at no additional cost. If you want access to any doctor anywhere, then you want to think Medicare Supplement. If you travel often or live in multiple states, you'd also want to consider Medicare Supplement or possibly even a PPO if you go the Advantage plan route. If you have chronic medical conditions, the Advantage plan might be a better option to consider, as generally they have plans related specifically for folks with certain chronic conditions like diabetes, cardiovascular disease, or COPD. And finally, if you want total predictability, you're probably going to want to lean the supplemental route because with those policies, it's more of an all you can eat buffet. You're paying your premium every month. That's guaranteed no out of pocket, no network. Go to whoever you want, as much as you want, whenever you want. And fifth is going to be the times of the year where you can actually make changes. With Medicare Advantage plans, you have about a 5-month window in the year to make changes. That's going to be October 15th to December 7th. That's a time where you can make any change to your Medicare Advantage plan. You also have a second window, which is January 1st to March 31st, where you can make one final change for the year. Our goal, of course, is to get you on the right plan from the beginning where you love it, you love me, you give me 5 stars on Google, and we're friends for 100 years. But we also understand your needs change, your goals can change, and so can these plans from year to year. And that's why we want to consider ourselves your long-term resource for your health insurance. With Medigap plans, you can enroll into those plans when you first become eligible for your Medicare Part B. Whenever your Medicare Part B first becomes activated, you have 6 months to enroll into a supplement plan without any underwriting. Should you decide to change that plan later down the road, you will have to go through underwriting and be healthy enough to qualify to make a change. And that, ladies and gentlemen, is an overview on the 5 key differences between Medicare Advantage plan and Medicare Supplement. If this cleared things up for you, please be sure to like and subscribe so you can stay up to date for future videos related to Medicare. The industry of Medicare is always changing, so staying up to date is the best way to make sure you're getting the most out of your Medicare benefits. If you already know which plan you want to go with and you're ready to enroll, we've actually included a link in the description below titled Enroll in a Plan. If you want to go ahead and help yourself, you can actually use that link to enroll into a program of your choice. If you need help deciding, feel free to schedule a call with us so we can help you in a one-on-one setting. So if you're still not sure what options are best for you, consider watching this video here where we actually go into a deep dive as far as what Medicare is and what your options are from a bird's eye view. Again, I'm Edwin with Insurep. Thanks for watching, and I look forward to seeing you on the other side.